Ladies and gentlemen, colleagues and friends, it is indeed an honor to be here today. Before I go on to introduce our distinguished moderator, I'd like to tell you a little story about a young girl named Namtevi. Namtevi was born in a small town on the outskirts of Kampala, Uganda, which happens to be the country in which I was born. Namtevi's mother died giving birth to her. Her father quickly remarried, starting a new family with his new wife. The responsibility of raising Namtevi was foisted onto a stream of relatives until she was finally married off at a very young age. Namtevi's siblings were boys. They had a very different childhood and were presented with many different opportunities, making a success of themselves and their lives. I would like to say the same for Namtevi. I would like to say that she fully realized her full potential within her marriage. But unfortunately, she never got that opportunity. You see, Namtevi, like her mother, died during childbirth, leaving behind a daughter she named Hope. Namtevi and her brothers were born into a society that has a different set of rules for boys and girls. And what this story illustrates is that if we don't acknowledge this inequality, we will fail Hope in the same way we failed her mother, Namtevi. It is this level of inequality that has a direct impact on global development. If we look at the current state of global development, it doesn't take much to understand that unless we move towards an equitable society that has this, where girls and boys have the same opportunities, global development will not be realized. This is something Pfizer takes seriously. We understand that for the hopes of this world, we must address healthcare system strengthening, education, economic development, and gender equality for women, or else we will continue to hear stories like Namtevi's. Our distinguished moderator, Ann Curry, is no stranger to the subject of women's rights, women's health, and global development. We all know her as the anchor of NBC News Today and the anchor of Dateline NBC, the network's award-winning news magazine. During her distinguished career, she has conducted numerous exclusive interviews with world leaders and dignitaries and has earned numerous prestigious awards. She has distinguished herself in global humanitarian reporting, frequently traveling to remote areas of the world for underreported stories. For example, during the span of 1 year, from March 2006 to March 2007, she traveled 3 times to Sudan to report on the violence and ethnic cleansing taking place in Darfur and Chad. In spring 2008, she broadcast live from the Democratic Republic of Congo, DRC, where she reported on the horrific struggles of women and children. Because of her interest and commitment to the rights of women around the world, we're especially honored to have Anne here today. She'll play a critical role with our distinguished panelists in drawing attention to why women's health is one of the chief cornerstones in advancing women's rights and world's economies. Ladies and gentlemen, please welcome Ann Curry.
Very auspicious introduction, and I appreciate that very much, although I have to admit that at the moment I'm very concerned about my hair. It was a bit of a rush, I know, for all of us to be here today. There is a lot of traffic and a lot of kerfuffle. There's a lot going on in the city, and so it is terrific that all of you chose to spend your time thinking about and talking about this issue. More than an issue, I think, it's about a fundamental question about our sense about what's good for our human family, for all of us collectively. And I have come to conclude from these years of reporting that it is time for a new revolution, because it is not just about equality and equity, which is important enough. It is about raising this world out of deep poverty, raising this world out of human suffering so that we can all rise as a people. There is information that is now emerging that if you allow women education and jobs, especially in developing nations, you can change the paradigm. You can allow these women to help remake their countries and raise them out of poverty. This is part of why there's all this discussion from the Global Initiative, the Clinton Global Initiative, and also there's a new book, and I'm not plugging a book, but Nick Kristof is a friend of mine, and we've had a lot of conversations. He's with the New York Times, and he's done a lot of research. It's really convinced me that, for example, if you give, if a man makes money, forgive me men in the audience, not 100% of the money will go to feeding the family and raising the family and helping the community. Some of that money goes to cigarettes and partying and other kinds of things. But when a woman makes money, especially in these developing nations, nearly 100% of the money goes to the children, goes to the house, goes to the community, goes to the flowers, goes to the economic development of that place. And the argument is that it's great that men are also holding up, as Nick says, half the sky. What about the other half of the sky? And that's how you raise the world out of this inequitable suffering that we're now enduring. And we have a fantastic panel who I'm now going to come sit with, but first let me introduce them. We have the Honorable Saudatu Sani. Did I say that right? Yes. Yes. She is she's from the House of Representatives in Nigeria, and she's also the House Committee, on the House Committee of Millennium Development Goals. She's actually the chair, the Nigerian chair. We also have Ms. Gro Harlem Brundtland. She is the former Prime Minister of Norway and the Director General Emeritus of the World Health Organization, which, as we all know, is very pressed right now with concerns about H1N1. And we also have Rachel Mayana. Please forgive me. Mayana, did I say it correctly? No? It's not me. No, I'm sorry, wrong person. I'm sorry, she's still coming. We have the Rear Admiral Susan Blumenthal, the doctor. She's a director, Health and Medicine Program Center for the Study of the Presidency. And she's also the first U.S. Department Deputy Secretary for Women's Health in the United States. So let's welcome our panel. So we just heard passionately told a wonderful story of one woman who had a child named Hope. And I think that that is a good place to begin. And I think, Ms. Sani, maybe you can help us with that, because we're talking essentially about, before we understand the solution, we need to understand how much women need hope. Speak to us about Nigeria, which has really made this, and actually, be given your background anywhere else you would like to speak to about the need for change.
Well, I want to thank you very much and thank everybody for inviting us to participate in this very important initiative. Nigeria, with 140 million people, we are experiencing a lot of maternal death due to poverty of women, illiteracy, many challenges that you can face. There are so many hopes in Nigeria. However, what we see, governments trying to commit some money, but there are many other challenges. In a family of 4, a woman delivers a baby, dies, leave her children, leave the husband, and you find in most instances the children also die because men do not handle widowhood properly. When a woman dies, eventually her child dies because nobody is there to take care of the children. They are sad, burdened with the death of the woman, and eventually the child gets neglected, not because they want to neglect him, but because there are so many other burdens in the family, and that small child, malnutrition, malaria, measles, the child died. So even though a country like Nigeria is putting a lot of millions of dollars to support girl child education, support reduction of maternal mortality, but if you look at the quantum of the problems, it is not something that one country alone can isolate itself. It is a global issue. So women's health is a global issue, and unless we address it together, you may find that a woman living peacefully in the United States, there are thousands of them dying in Africa. So we need to work hard to make that hope have a life at the end of the tunnel.
And it's not just, as we all know, just in Africa or in different countries in Africa. It is also in other places that there are such great injustices and inequities when it comes to women being used, for example, for sexual slavery in some parts of the world. There are health issues involved. There's so many problems. It gets to be a bit overwhelming. And I'm wondering, Dr. Harlem Brundtland, I mean, because you really focused in your tenure at the United Nations, one of your guiding principles was evidence and health as central to development. So basically what you looked at is the global development community and whether or not it's responded to this principle. The question is sort of, I think, you know, is there a way to make it simple? I mean, is it really just about dealing, for example, with the health issue? Is it about dealing about human justice issues? In other words, if women can be as powerful as men, does that solve the problem? Does that deal at least with the problem?
Well, you know, we are into a very complex issue here, in fact, and the question you ask illustrates it. But let me just say a few things about how it felt to go to the leadership of the World Health Organization and trying to see what can that institution do, how should it work, and work with others so that the effects of what we could do to get positive change could be maximum. Now, as a politician and as a former prime minister and environment minister, etc., I had a lot of experience, and I knew how important political decisions are. That means how important democracies are, how important it is what people here in New York or any other place, what they feel and what they ask of their leadership, and what they do on their own to make a difference, what organizations they get involved in. You know, if we are going to change the world so that women are better off and that we are building the capacity of new generations of girls and women so that they participate fully in society and have the rights like men, then we have an enormous job. From religion to policies of countries where you don't have health systems invested in, where you don't have education for all, where you have enormous gaps between the rich and the poor, you have dictatorships, you have religious pressures on women in many countries, even today. So the scene is large and complex. So one of the things I decided was I need to see to it that WHO can give the correct evidence, the correct information about the global scenario of health problems. And then one of those problems is health of women, because women are underinvested in so many ways, also that affects their health. And this is a global situation, at least in very many of our countries. So then, just to give you one statistic, which I think shows there is no greater disparity in the health statistics in the world than the one between women raised in the OECD countries, in the rich countries of the world, and in the poorest countries in the world. No bigger difference in those statistics than with regard to maternal mortality. So mothers die because they are giving birth to children at a rate which is astonishing. You don't believe it until you hear it. 1 out of 4,000 mothers in our countries risk to die because of pregnancy and childbirth. 1 of 4,000. Most of us have never heard of anyone who died because they gave birth. In the poorest parts of Africa, for instance, it will be 1 out of 15. So 1 out of 15 women die because they give birth to children. There is no more dramatic statistic around. Then you can ask the question, why is that statistic worse than many other bad statistics, which we can have in Nigeria, in Rwanda, many places? Well, you have also to ask the question, because the roles of women are different than the roles of men in so many societies. As you give priorities in societies about where to put your efforts, those that have affected women have been bottom of the list. Now, the worst part of the story is when you then try, as we did in WHO with UNICEF and UNFPA, other institutions, and of course others, partners, also from the private sector, to raise the issues and to get it onto the agenda and to increase the investments. As you do that, you realize that to avoid women bleeding to death, not being transported to a hospital, which can be far, far away, which is one of the reasons why women die in the first days or week of after birth, then you need to have a health system. You need to have a functioning health system. And that is not done overnight, but it has to be done. So we have to be aware that not only investing in education, and education of girls more than anything else, because of their important role in society, we need to invest in functioning health systems for all people. Because it is essential from a humanitarian perspective, but also from an economic perspective. Because if populations are poor, sick, undernourished, they are not going to be productive. And we will never see economies grow in poor countries.
Just to interject, because I think you really spoke to something that I have an example for to augment what you've said. Just recently, our team was in Pakistan, and we saw a woman who was giving birth. And the dilemma for her was that in Pakistan, to go to the hospital to give birth, you have to ask your husband's family for permission.
Yeah.
Her husband's family said no. It was going to cost $3.15 to take that cab ride to the hospital. They didn't want to spend it. P.S. They didn't really like her that much anyway. They thought she could do it on her own. 5 days into her labor, finally her aunt, her own blood relative, said, that's it, you're going to the hospital. Came up with the $3.75. And she went to the hospital. The baby was born blue. Our camera's rolling on all this. The baby is born blue. They're struggling to save the mother. They were finally able to save her life. She would have died had she not gone to the big hospital at the last minute. The scene of the nurse trying to pump air into the baby's body using a hand pump that was basically a little circle that opened up, filled up with air, and she pushed it and the air was going in his lungs. The look on her face, seeing, this is what's happening every 15 births, this idea. And then they whisked the baby away, and we discovered that the baby had in fact died. But even worse, the story is from the friends of the family that had they known the baby was a boy, they would have given her the $3.75. So this is part of the dilemma. It's the money, the system, it's also the disparity, and that creates this injustice. Rear Admiral, you've looked at, and you can speak to the fact that while we're focusing on countries that don't have adequate or have enough medical systems to really save these women from dying, this is still also an issue in the United States as well. But you can also speak globally. I mean, we're looking at a problem that seems so huge, so impossible. And I think that the question is, when you look at all this, all these stories, how do we focus ourselves and what to start with? Any problem, you've got to look at, okay, where do you begin? So how do you begin to wrap your head around what must start to save these lives?
Well, I think, as we're saying here today, health is very much a global issue. It's a global issue for humanitarian reasons, for economic reasons, and for national security reasons. Women constitute over 50% of the population, 3.1 billion women, and yet their health has been neglected. Even in the United States until very recently, women's health was neglected in the halls of public policy, at the research bench, and in clinical settings. We didn't target our prevention trials, whether it was to stop smoking or to encourage a healthy diet, to women. So we didn't have the evidence to guide treatment and prevention decisions. Worldwide, our income and education levels are the most powerful predictor of our health. Every step down the income and education ladder takes us up steps in terms of premature death and disability from disease. So even in the United States of America, we rank highest for all nations, of all industrialized nations, on maternal and childhood mortality. As we've heard in the recent healthcare debates, 47 million people are uninsured. In the United States, there's a 30-year discrepancy in life expectancy between an Asian American woman living in Bergen County, New Jersey, and an African American man living in a city, in a major urban city. So I think that human rights, women's rights are very much entwined into her health care. Women suffer from lack of education. They're prevented to get an education, from occupational opportunities, from gender violence, from sex trafficking, as we've mentioned, and all of these things compromise her health. Now, worldwide, we suffer, every nation, from the double jeopardy of both infectious and chronic diseases, in addition to the serious problem of maternal and childhood mortality. 1 out of 4 deaths in our world is due to an infectious disease. And with the flu pandemic that's looming, with the AIDS pandemic, here's an example with AIDS. It was considered to be a man's disease. And so we didn't target our interventions to focus on women. We didn't think they were at risk. And as a result today, worldwide, 50% of cases are in women. But women don't have the same access to treatment and prevention services as do men. And if you think about it, in some countries, the life expectancy has gone back to what it was during medieval times because of the impact of this pandemic. So then there's chronic diseases. 79% of the chronic disease burden, like heart disease and cancer, is in the developing world. So we're seeing, as we clamp down on tobacco use here, it's moving to the developing world. So that in the next 20, 30 years, 70% of tobacco-related deaths will be in those countries, robbing them of the people power, the productivity, and the money they need to build strong communities and countries. What we learned in the United States, and I'm very proud to have served as the country's first Deputy Assistant Secretary for Women's Health in the 90s, we exposed the inequities in women's health, and then we worked to put programming, to put a focus on research and education and prevention programs on women. And we work together as a global committee now to share the lessons learned. But I guess what I want to emphasize is that there are, as you're saying, a lot of issues. But if we work together as a community, as a globe, and if we share the lessons learned, I think we can make progress.
So you're saying something very important. You're saying the more education you have, the more likely you are to live a longer life. Then the less education you have, the more likely you are to die. And then what you're all saying is that women are less likely to get the things they need to live because they don't have as much education. So they're more. So in other words, the sexism kills is what we're talking about.
And then what you're saying is too, when you talked about half the sky, the Chinese proverb "half the sky," is that women are essential to educating a family, a community, a country, and then the stability of the world. So if you're depriving her health and you're not educating her, then the world is suffering.
And this is the world we're leaving to our children and our grandchildren. It will be a better world if there is not this kind of deepening and widening inequity between the extremely poor nations and the extremely wealthy nations. This inequity does not bode well. It clearly is a major issue. We talk about a lot of the issues when we talk about, in fact, one of the other theories is that if you want to solve terrorism, if you really want to solve terrorism, then you have to do something about the poverty that allows it to grow. And poverty allows it to grow because people feel they have no other hope. So this is sort of really all wrapped together. These aren't separate issues. So there is a real reason, I think, that we all will want this kind of change that you're talking about. And we are also joined, and I know you had a prior engagement, and we thank you so much, Rachel Mayanja, for joining us. She's the Assistant Secretary General, and she's also a Special Advisor on Gender Issues and Advancement of Women at the United Nations Department of Economic and Social Affairs. Thank you so much for joining us. And I guess since you are really representing the United Nations really here, and so you have a really an opportunity to give us a kind of a global perspective, you know, I think a lot of people would wish, well, okay, so now we know that we want to do something. Okay, we know that there's a problem and we want to leave the world a better place for our children and grandchildren. Well, what can we do? What should we be doing? What is our greatest hope?
Thank you very much for having me, and I apologize for having come late. It's a crazy day across the UN. And thank you very much for focusing on this issue. In fact, I was attending another roundtable which was also focusing on the women's health. And I think that I can really add very little to what already Dr. Gro Harlem Brundtland has said, who was also at the United Nations. As all of you have said, these are global issues. Women are dying around the world. It's not in any one particular region, it's not in any particular countries, it's all over the world. And why are they dying? In, of all things, basic reproduction of humanity. If women had the power to say, okay, we all don't want to die, we are therefore not going to reproduce, can we imagine what is going to happen to our species? So obviously one would imagine that this would be a priority for member states, a priority for all communities, a priority for families. We just heard this shocking story, but it isn't. And why is it not? It's not because we don't know we need to do something. As has been said, it's because women's concerns have never made it to the top of the priority. The provision of health services in communities, especially in rural communities, one would imagine that this would be a priority, but yet it isn't. We have seen in the United Nations that of all the Millennium Development Goals, the one that is doing most poorly is maternal health. And so you come to ask, why is it that we in the United Nations have failed to make a dent in this area? And I think, as Dr. Brundtland said, it is the complexity of the issue. Because we women, first and foremost, we are women, but secondly, we belong to our community, we belong to our religion, we belong to our family, and we are caught in the constraints that come with each and every aspect of those. So therefore, until we have been liberated from these constraints, we are not even placed in a position where we can demand that a health clinic be built in our village, or else we will not pay taxes or whatever it is that we should be paying. We do not do that. We allow customs, negative customs, to kill our children. How many of the women who are dying in childbirth are below 20 years old? We marry our children off 10 years. Last week there was a story of a 12-year-old who died in childbirth. They are not even, their bodies are not ready for these functions. But we allow our customs, negative customs, to take over the rights to life of our children and of our women. Until we reject this, nobody from outside, not even the United Nations, is going to change this situation. We've got to start working from inside. from within our family. How can we allow that the husband's family says no $3 will be given to this woman to go to the hospital? Until we challenge that situation, the United Nations is not going to make that family pay the $3. But nevertheless, the United Nations is doing something. You have heard from Dr. Brundtland that a number of agencies are working together to provide support to member states, to provide support to NGOs who are working with the communities on health of the women and girls. At the Economic and Social Council this year, one of the main themes of the annual ministerial review was health. And it was interesting because member states are then subjected to peer review of how well they are providing health services to the community, what they are doing to reduce maternal mortality. We are making progress, but it is very slow. In the 21st century, the statistics we have just heard surely should be unacceptable. And on our part in the UN, we have certain unique advantages. One, we have a convening power. Just yesterday, the Secretary General convened the heads of state and government on climate change. So we can convene governments to come and account to the global community what they are doing on these issues. And I would suggest that health really deserves a summit, because giving birth should not be a death sentence for women. We also have the advocacy, and we go around trying to convince people like you, member states and governments, to raise these issues to the priority of the national agenda. This will continue to do.
Well, I think you point to a very big thing. The first thing we can do is care. And anyone, when there's a rising population of humanity that cares, that in itself matters, and that in itself is transformative. I think that's really important. You also talked about this idea of women standing up. But can that really happen without a way to connect to other women? Education, what does it need to be? I know that you're shaking your head yes, and I know also, Doctor, you had something you would like to say. Let's let you respond to what we just heard, which is a very strong statement.
Well, let me start by looking at myself as an African coming from Nigeria, in a country that contributes 10% of maternal death globally. 800 women per 100,000 births, 52,000 women per annum die through childbirth. And yet
50,000 every year?
Every year.
52,000 every year die.
Every year through maternal death. And in a country where we are supposed to be very rich, yet we are dying silently. Well, the key to solving this problem is education. Education is very important. My mother married at the age of 14. I got married at the age of 19. My daughter got married at the age of 28. So gradually, when you receive education, we are trained to say no. You know what you want, you plan your life. So there is no amount of investment in education that can do to girls that will help to change this. When you are educated, the girls can say no. That mother-in-law syndrome will cease to exist, because an empowered girl child will say no to her mother-in-law, or will say it in a more diplomatic manner. But we have witnessed many deaths. In fact, when she was talking, I felt like crying. There are stories, we know them, we can name their names, that have gone into the labor room and come out stiff, dead. There are children that are, when you come out with a baby, everybody is in grief. They forget the baby. The baby also dies. In a poor family, they don't know how to handle a one-day-old baby, because they don't know how to press the milk. They don't know where to get milk to support or formula. So as I said, death in Africa, death in Nigeria is death all over the world. Because when the Africans keep dying, or women keep dying, there's a big challenge in the world. There's half of the humanity are going because they are bringing life. I want to repeat that when my daughter is pregnant now, when I see a young girl pregnant, my heart begins to bump because I don't know how the pregnancy is going to end. Simple, preventable diseases can cause death. So there's no amount of money that we all get put down to reduce maternal mortality that we say it is too much. We must all stand up. In fact, if you see this white ribbon, I'm wearing it on the head. I sleep on it. I sleep with it. I wake up with it. I walk with it. It's something that bothers me every time. Giving birth should be something happy. We should be happy about it, not sad. And when people get in and then say, oh, government are not working, there are many challenges. Governments have a lot, and women are the least. When the government are planning their money, budgets, they think about arms, industries, environment. The woman is the last. She's the last.
You know, it's interesting, you know, the first woman ever elected president of a nation in Africa, and she was elected before the United States has yet to elect a woman president, but her name is Ellen Johnson Sirleaf. She's the president of Liberia. And it's been remarkable when women have access to power, then the women also have a greater opportunity for change, for education, and that's exactly what's happening to Liberia. So it's about power, and it's about opportunity education that lets you have power. Doctor.
Yeah, I was going to just mention, since we are here, you know, the day after the climate summit, that everything that we have talked about now, and which was a great challenge back in '98 when I first entered WHO, and has been an important issue on the agenda since then, you know. Now we are aware of the climate challenge and how also the climate challenge is affecting women even more than men. Because of the roles that women had, because of the fact that in agriculture, the women are the ones in many poor countries who see to it that the family is fed, who do the work with the soil and to try to produce the food, cook the food, you know, everything that has to do with the family's nutrition. And here climate is, you know, hurting poor families and poor parts of the world more than anything else. Desertification, even more problems with water, which again hits health, hits agriculture, hits nutrition. You get, you know, the spirals of negatives. And so we now talk about climate justice. And one of the issues there is not only, I mean, who is responsible for the climate situation we have? It's us, it's the rich world. It's where we are. But in addition to that, from the global point of view, there is no way to avoid the catastrophe that will come unless we change than if we are able to collaborate and work together across the borders and to help overcome poverty and to help the countries adapt to the climate change that has already happened and to help poor countries have a better pattern of development, and that means improving the role of women. Otherwise, we will not have a better pattern of development. Exactly. Because, and if we don't, you know, we will all suffocate through the climate crisis that will come. So it's as if we had learned these lessons, but we have additional challenges. Now, this doesn't make me pessimistic. I just think it is more possible that more people, even men, understand the linkages between the challenges we are facing and the important key role of women, of health, of children, in facing up to them and dealing with them as a global community.
But I also want to repeat one thing I said in my first intervention here. This has to do with policy making. Countries, I mean, the president of Liberia, as much as he can, will try to move her country in the right direction.
Yeah.
You have NGOs, you have people's action at the community level in every country trying to make a difference. Now, if we don't change the ways decisions are made, so that they are not only focused on military and on issues which are not more important than the lives of women, children, and families. We have to change those. And, you know, although we have the United Nations, although we have global efforts, we must never forget that most of what happens at the national level, happens with the source and the forces of the people who live in each country. They can be helped, they can be educated, they can be supported, inspired, but it boils down, you know, to participation at the local community level and the things that you can do to change your own society. Because nobody's going to come from somewhere far away and change, you know, your community. Mm-hmm. It has to come also internally, but with the support that you deserve.
That's a very interesting point, because actually great social change, great, what do I want to say, human evolution towards greater compassion generally doesn't come from governments. It comes from the people. Mm-hmm. And it comes from people who, like you, who care about something enough to think about it and want to do something about it. And what you just said, Doctor, is that you're saying that if you are concerned or connected to what you can do to improve or to contribute to a better environment, to sort of work in that way, you are also helping women. You're also helping people who are poor. There's a linkage there. And I think that the other point you made, I mean, there's been a lot of bad news so far in this panel. And before people get too discouraged, I mean, really, to be honest with you, you know, I think I can hear in all of you this fierceness, this kind of warring for the future you envision, this future that is moving away from where things are. And in fact, that is incredibly hopeful. And if you weigh that against what used to happen, the past that once was, where there was even less compassion in the world, where things that are unacceptable now were acceptable. Once it was perfectly acceptable to rape women and kill children as a part of your war. Now, we know it's wrong, and we call it a war crime. The next step is now for us to know better than to even allow it anywhere, much less in, mostly. We need to not, so this kind of progression is what you're a part of. You're all part of a progression that's fighting for the future, to make it better. And I think that's incredibly hopeful, because things have changed. They just haven't changed fast enough. There's so many friggin' laggers, I can't tell you. So, Dr. Blumenthal, in terms of this, I mean, what I'm hearing now are several things. Women need to fight against inequities. Women need opportunities to be educated. People need to make the linkages between things such as climate change, to sort of understand that that all contributes, that is a way of contributing. What else might you add in terms of, if you could change one thing, if there's something you could just push a button on and that would start the chain reaction, what would be the thing you would do to kind of create, to start to move this world towards a greater equity in this way?
I think it would really be an emphasis on prevention. You know, whether we're talking about prevention of violence, prevention of disease. I mean, we're talking about the combination of education and individual education as well as social responsibility. And if you think about it, health is really a common currency across our globe for sharing of knowledge, understanding, and for peacemaking. And you know, whether it's 27,000 children that die every single day, you know, 80% of them are preventable causes. you know, think about it, if for the equivalent of 2 Starbucks coffees a week, we could prevent 80% of these children's death. How? We could do it with safe, you know, birthing kits, through vaccinations, through simple antibiotics to prevent common bacterial illnesses, through rehydration therapies. I mean, these are simple, preventable interventions. And it means, if I were to tell you that there was a terrorist at loose in our communities that was responsible for 1 out of 5 deaths in our world, you know, would that person be on the FBI list? No, it's tobacco. It's tobacco. And then there's malnutrition. 66% of people, I mean, growing in the developing world as well, where obesity and malnutrition are now coexisting, are going to rob countries, again, of the productivity to be able to build healthy societies. These are things that are preventable. And that's why, at the individual level, we need to be educated. But at the social level, working across with the UN, with the World Health Organization, with each country's creating a plan. For example, WHO has come up with a diet framework, a nutrition framework, a smoking treaty, smoking prevention treaty, where countries share lessons and work together to prevent things from happening in the first place. Because we tend to be sick care society, not healthcare societies. And putting that emphasis there is critical. But again, the cornerstone is education, it's putting an end to discrimination, and it's occupational opportunities. And they go hand in hand with a healthier future. You know, Madame Curie, who, by the way, was never admitted into the all-male French Academy of Sciences after she won a 2nd Nobel Prize, once said, I never see what has been done, I only see what remains to be done. I think there has been much progress. I think from the time we started working in Women's Health 15 years ago, how much has been done, and yet how much still remains to be done.
You know, if you want to change the world and you feel that feeling, that mission, and actually the reward of having tried to make a difference, then you'll not be disappointed, because there's a lot to do, isn't there?
And
there's a lot to do.
The voices here of the women here, and I know the people in this room, I mean, are powerful you know, reminders of the progress that can be made and what a difference one person makes, as well as working within their organizations for change.
Ms. Mayanja, is there some goal that is achievable when you look at this? And this may be hard to answer because it means projecting, and those are always hard to answer. But you know, I think it's often easier if we can think in terms of what we would like to achieve by when. And I know that the Millennium Goals are a key part of that. On this topic, is there a way for us to aim our direction? I mean, we've talked about education, we've talked about all of these different issues, and caring and all these things. But what, for example, I'm just going to pull, you know, by 2050, could we as a united world achieve because that would be within the lifetimes, you know, of our children. Could we achieve to make not only the world less poor, more equal, but also more safe?
Yes, I guess the member states have committed themselves to achieve the Millennium Development Goals by 2015, which include all that we have been talking about: eradication of poverty, universal primary education.
You have to push that date back a little bit, do you think? 2015 is pretty soon.
Well, I think we should keep the date and put the pressure on them to accelerate, achieving these goals. No, I think what I believe is achievable is the MDG on universal, primary education. And I think most countries are almost there. There are a few countries in sub-Saharan Africa which are lagging behind, but I hope if we inject a little bit more momentum, that perhaps, and give them support, that perhaps even they could come close to that.
Let me understand what that is, because I'm not sure everyone else does either. Primary education for all children?
For all children.
In the world?
In the world.
And that is a goal that is now being close to being achieved?
That is being achieved. Yeah, it's very close. I think this is the only one that I can really see being achieved. But the others, as we have talked about, you know, with the maternal mortality, we are so way behind that I don't think that we could really push and get close to achieving that goal by 2015. What I think is important is not so much for me achieving these goals as we have set them, is to reevaluating the situation and changing the agenda, the national priorities. We have heard that many countries, including Nigeria, place armament, defense, high up on the top of their priorities. If we can achieve, for me, if we can achieve placing the issues of women's interests, gender equality, up high on the agenda of member states, for me, that would be an achievement. Education is clearly one of the key solutions to many of these problems. But that education is not only in terms of formal education. It is also in terms of awareness raising for people, especially those who are illiterate and will not be able to go to school for formal education, but educating them on how to take care of themselves, how to take care of the children. That, I think, community education, that is achievable if we really committed ourselves to working towards it. And that would require partnership. And I think that's perhaps one word that we haven't used enough, the partnership between communities within the nation, but the partnership between nations, between civil society and government, between private sector and communities and government. We need to partner together because no one group, not even countries, we've had these countries are poor and they're confronted with a number of challenges. And they cannot begin to establish priorities among those. What should come first, food or health or education? I mean, they are all deserving priority attention. So I think we can only do this if we focus on partnering and supporting each other.
One of the things that I wonder if maybe, you know, when you argue about gender equality, I mean, that sometimes is not an argument that goes very far. It has historically, anyway, not gone very far. It's always been a struggle. But when you make the argument, and I wonder if this can be supported, that if you argue that, in fact, your nation's GNP will rise, as China now having enabled women, I think that is really what's unleashed the tiger of China, that women are now in the workplace and men are in the workplace, and that place is going so quickly. You see these sort of borderline so-called developing nations start to move when they start to allow half the sky to get involved. I wonder if that argument, I mean, every nation wants to not be considered off the main grid. And you know, you were talking about Nigeria, and so you're in the House of Representatives, girlfriend, and she just said, you know, why are they spending so much on defense? So, you know, so that's really, I wonder if that argument would play if you were to say, look, it's going to help our country.
Well, let me make a correction. Nigeria is not spending only on defense.
No,
Nigeria have committed a lot of money on the attainment of the MDGs. Even we are one of the lucky ones to get the debt relief. We have committed consistently 110 billion naira, which is around $300, $500 million for the...
Is it enough?
It's not enough. It's not enough. The reason why it's not enough, we are many. We have many other challenges. We have poverty. We have a food issue. We have a lot. That's why I say the issue of attaining MDGs is a global responsibility. Everybody has to be on board. And then when I come back to look at it, we have in Africa, there's democracy now in place. And we are involving our parliaments. Parliaments should start to ask governments questions. What are you doing with our money? And that's what we are doing in Nigeria, making sure the money being allocated for ABC is being used for that purposes. And then if you look at my country or any other country in Africa, who provides health? provides health. When you go down to the little nitty-gritty of who takes care of health, it is the household. And who is in charge of the household? The woman. So when you empower the woman, who makes the decision to take her child to the hospital? Who makes the decision to feed her child what kind of food? Is it going to take potato or vegetables or meat? Then the most important thing is giving education to that one human being, the woman. If she's educated, she's able to use her education to take care of her children, take care of her husband, take care of her immediate environment, give them good food, highly nutritive food, and then provide the small health within her house, into the community, into the larger society. So we as a nation, for us to achieve MDGs, we have to talk to the lowest level of the humanity, that is the household. We must take health to the household, take health to the community, empower the community so they can start asking questions. They can ask their government, they can take them and say, we have this issue, what are you doing about it?
You know, so what you're really saying is that when you give women who are in these, who are, as you say, at the lowest level of poverty, if you give them those tools, you're not only saving the woman, and I have been arguing, helping raise people for poverty, you're also saving all of her children.
Yeah.
You're giving her children. So there's a larger number involved. You know, I wonder, Dr. Blumenthal, if you could tell us about, you know, if this is all true, this kind of stats that we're looking at, and you just mentioned that maternal mortality, the maternal mortality rate in the United States is really not so terrific either. So I guess what I'm wondering is there a correlation? Are the women who are mostly dying in childbirth in the United States, do they tend to be poor? Do they tend to be less educated?
Yes, of course.
So it's the same human problem across countries.
So to my point that our education and income levels are the most powerful predictors of our health, whether it's the United States or any other country of the world. Did you know that 1 out of 3 children in our country, in the United States, is born on Medicaid? So, you know, we have huge gaps. 1 out of 12 people live in poverty in the United States. But 1.1 billion people live on less than $1 a day in the world. So, you know, these are the things that are driving a lot of the inequity. And women are still paid less for their work. They suffer discrimination and bias. And this affects their health. And then it affects the health of the community and the globe.
So I think she just said I have 5 more minutes. Is that what you just said, or? Okay. Right. We would like to offer this panel to you if you have questions, because I know we probably have not explored every single topic. We've got microphones, and I have been so selfish to not give you this opportunity sooner. Would you like to start, sir?
Yes.
Just jump in front of the line.
The question I have has to do with how do you resolve the dilemma that exists that a lot of what we in the West consider human rights, people in the third world consider cultural imperialism, that practices that violate long-established cultural norms there, and how do you resolve that dilemma?
Dr. Babs, you're perhaps the best person to answer that question.
Well, you know, I have to tell you a story from Davos. There was a number of leaders, foreign ministers, prime ministers, and I was Director General of the World Health Organization. We were discussing cultural rights around that lunch table. And there was the foreign minister of Iran was one of the participants. And he was very strongly engaged about the importance of cultural rights. And several of my male colleagues around the table, I was the only woman there, were kind of not only listening politely, but they were supporting his views. And then as I was sitting quiet listening to this, I was kind of watching, is anyone now going to raise the question of human rights? No, they didn't. He was able to pull them around, defining cultural rights in ways that was undermining the Declaration of Human Rights. So I made one point. I just asked a simple question to the foreign minister of Iran. I said, Mr. Minister, I'm okay with cultural rights, except when they are put over and above the definition and the principles of human rights. That was the end of the discussion. He had no response. Everybody around the table understood we had been taken for a ride. So why I'm telling you this is because if we try making difference, between, or making judgments about different cultures and accepting obvious violations of human rights towards women, children, or men, whatever, in the name of traditions or cultural differences, then we are really badly off. We have to be courageous enough. Not that we should ride into any village and start, shaking our flag, but we should never be accomplice to continuing breaking human rights. We should be helping changing those traditions which are in fact not cultural. They may be traditional, but they certainly are not a culture of the future, and they have nothing to do with human rights.
I feel like applauding. I don't know about you. Well said. Yes, what's your question?
Hi, my name is Holden. I'm a student at Baruch College. My question is largely from one being on the outside looking in, so bear with me for a moment. I just wanted to shift gears just a little. When it comes to women's rights and empowerment, specifically, in what ways and to what extent are women their own worst enemies? For example, during the presidential campaign, most of Hillary Clinton's opposers and critics were actually women. I saw this on the news. Many of the women interviewed would simply say, no, I don't like her, I don't trust her. And it really got me thinking. In the case of the pregnant woman in Pakistan, for example, I also started to wonder how many of the family members that wouldn't give her the money for the cab fare were actually female. And you see this in the workplace, you see it in schools, you see it everywhere, this almost women against women relationship. Why is this, and in what ways can we overcome this? Thank you.
So you're asking whether women also you're nodding. You agree with this?
Well, I'm a politician.
You're a politician, yes.
I'm a politician, and you find that many women don't support their women counterpart because it's very difficult to be a woman politician because you have many constituencies. The women are your constituency, you have your constituency, you have your family constituency. So women assess you the way they want you to be, so they want you to be the best of the best. And if you make a mistake, they quickly come out and say, she's not doing the right thing. I don't think women really hate women. It's only that the men started that notion and they continued with it and we didn't change it.
Anyone else want to add? Would you like to add something to this? Do you want to say anything?
Yes, I agree with you. You see, I think there's almost a presumption that women, because we are women, we must always agree. But men may not always agree. They can have different views on issues, but we must have the same view. The fact that there is a woman candidate who stands for very conservative positions or very radical positions, why should a woman who doesn't stand for those positions support them? Exactly. Just because they're women? No. We also have our own intellectual and way of making decisions. We support what is acceptable to us. Yes. That's one. I think where it appears as if women are their own enemies is when we cling to old traditions that have been established by men and we impose those on ourselves, on our girls. Yes, then you could perhaps interpret that as we women being enemies of ourselves, because we are caught in this, and we see this throughout the world, that women project and they're the custodians supposedly of custom, and therefore we tend to hold on to those things that are negative to our own interest, including our human rights.
I think that the enemy is anyone who would step on human rights, and that can be a man or a woman. Yeah. The question is, so would you have a question?
Yes, it's actually comments and questions maybe. My name is Rose Sarr. I'm from Senegal. I had a chance to have a mother who was already not only educated, but had enough money to send me to study abroad. So I have one comment about education. I'm standing here today working for the NGOs and the UN because my mother sent me to school, as I said, but also because I'm a brain from Africa that didn't stay in Africa. Same case as the Ugandan girl who's from Uganda and who's working for an American company. I really believe that the economic empowerment of women is more important than the education. I don't know what the panel think about that. Okay. And I'm sorry, my English is not that good because I'm a French-speaking person. And also, I think democracy is something that we should really put emphasis on, because educating women is a great thing, but we also have to give them the opportunity to be at the policy-making level. I don't know what the panel would think about that.
All right, thank you so much for your question. I think you're a good example of what the ways...
Not even economic empowerment in terms of millions of dollars, but just the microfinancing part of the work is great, and we've seen it in Bangladesh, we've seen it in so many countries in Africa. Okay. Just give us the opportunity of being part of the economic development of our own countries.
Thank you very much.
I think we all agree. I mean,
but she's saying she thinks it's maybe more important than education.
No, but you can't do it.
You can't do it. No. So you can't have economic empowerment than education.
Education is everything.
But both is what
I'm sorry, I'm taking a lot of time, but I totally agree with the education part. What I think is, once we are educated, we also have to have the opportunity of...
I think they completely agree with you.
Yes.
Absolutely. And I think that you're also a good example of, the loss when we don't have education. If you're saying that you're lucky to have gotten education and to be working for an NGO, which is a major job to take care of something that's trying to contribute to the greater good of humanity, think about the loss of all those people who didn't have that opportunity and what that means collectively for our human family.
I guess education doesn't have to be, going to high school or college. As we said earlier, education can also be skill building.
Towards
skill building in order to for health, for practices, for not engaging in discriminatory practices, those kinds of things. So it's modeling.
I think you're next. So yes, what's your question?
I was wondering, since you're all such wonderful communicators, if you could talk a little bit about a communication strategy. There are more men in this room than I've ever seen on a panel about this issue, and I think that that's amazing, and we should take advantage of this. So many aspects of this debate are so horrific. I mean, you can't sit at a cocktail party and talk about fistula caused by sexual violence. And I was just wondering if any of you could try to help me with how you can raise awareness for this issue and how you can talk more about this issue without turning people off because it's so awful they have to turn off.
I have an answer to that. Anyone like to take that first?
For fistula?
Well, it's communication.
Right. Well, I think, communication is my job. So I think that the time is now. This has become a major goal for the Clinton Global Initiative. There are now books out talking about this idea. There is now a kind of a growing sense And oftentimes, when there's an opportunity, when awareness starts to rise, it's a fantastic time to jump on and shout a bit louder so that people really understand that to connect the dots. You know, this is not your grandmother's or your mother's definition of gender equality. This is gender equality that includes that and much more, because it talks about changing the world, and not just to make equal for women, not to belittle that, but it also talks about changing the world in a way that talks about feeding children and decreasing suffering for nations. So that's a broader context. I think that in terms of how to communicate this idea, I think that what's interesting to me is that what has been communicated until now, I think this is phenomenal. I'm going to tell you this, it's phenomenal. There are now 10 Ks in this country to raise awareness and money for the women who are suffering sexual violence in Congo.
10 Ks.
There are groups, there are more groups than I can count, concerned about the sexual violence against women in Darfur. There is such a growing sense about what is unjust, and it brings to my mind and this may be true everywhere in the world, but I know it's true in America, that when people are, and women specifically, on these kinds of issues, because a lot of these 10Ks and dinners, there's a dinner fundraiser on the Upper East Side now for the women of Congo. It's remarkable. Ideas, passion, emotions about the inequities of things give rise to people wanting to do something. And oftentimes the problem is, what can we do? What can we do? And so directing people to know what people can do. And I know you're raising your finger because you know something we can do, yes. Right? There must be organizations that we can help enable. And we need to know which ones are the best ones. We're not going to waste our money, but we're going to put it in the right place.
No, I just wanted to just add to what you have just said, that we do need to tell people the way it is, but not to leave them with this enormous, horrible story for which they don't know what to do. Therefore, to communicate effectively, we must also give them solutions. Mm-hmm. We have to offer, even if our solutions may initially be limited, but we have to give them a solution so that they see there is a problem and something can be done about it, and right. They can contribute to doing something
exactly.
About
so there's
it.
You can create a sisterhood, for example. I'm thinking of an organization called Women for Women, which is a fantastic group, and they've been hugely important in gathering women to work for women elsewhere. And you know, it's phenomenal. Like, you know, I was speaking to someone with the International Criminal Court just actually earlier today, and he said that there were 2 young men who were in Uganda and who discovered the problem of children sleeping, you know, running away so that they wouldn't be kidnapped to become soldiers, running away and sleeping away from their own families. And these people made a movie. The poor kids, 2 college students, made a movie. And then they went college campus to college campus, and then there were suddenly 4,000 young people who'd all gathered, and each one contributed $20. And they were raising awareness so that they could create funding to help the children of Uganda through the organizations that are directly on the ground trying to ease their suffering. So I mean, I think it's really about being empowered. And here's the really cool thing. I don't know why people don't do this all the time, because when you are actually effective in any way, when you are actually able to feel for a second that something you have done has eased suffering for someone else, especially in a place where there is nothing, when there's nothing, you know, when there are children or women who've been raped to the point where there's nothing. And I can tell you stories you don't really want to hear, I'll traumatize you, but when you see these people and there's something you can do, it doesn't just change their lives, it rewards you. It is the most selfish thing you can do, because you find all of a sudden your usefulness, that no matter who you are, it doesn't matter anymore whether you fit into that pair of jeans. It doesn't matter anymore how many wrinkles are on your face. It doesn't matter anymore. So many things that seem so important. What matters is that your life matters more. Your life matters more because someone else is suffering less because you're trying to help them. That is the most selfish thing. To me, that is the fastest road, not just to heaven, it's the fastest road to personal happiness. Yes. The fastest road to personal happiness is to try to ease someone else's suffering. And when you're thinking about whether it's a poor woman in a place in the world where they don't have education, even in the United States, and so as a result she's more vulnerable to losing her child in childbirth, or whether you're talking about a person in Nigeria or a person in Congo or a person in Darfur or any other places in the world where women are suffering, and anyone is suffering, a man or woman or a child, and you can do something. That is phenomenal. And that would be what I communicate, and that's what I try to communicate all the time. And there are many organizations, Women for Women, Doctors Without Borders, there's so many organizations that are boots on the ground, that have people who are doing something about this. And I think I would just simply say, if you can't contribute because you don't have the money, then call them up and volunteer your time. Exactly. There's nothing that really will make your life more rich than having done some even small part. Yes, ma'am. Would you like us to get to the microphone?
Somebody's standing there.
We'll bring the microphone to you.
My name is Marlena Cranen from East Lansing, Michigan, and I'm a health ecologist and a storyteller, and the two really go together. Now, what I have long thought is needed, and particularly with the advent of Darfur, was a woman's international court, where women would say, when all these guys came riding in on their horses and slaying the women, hey, guys, this is not within the domains of our court. Get out of here, we're sending our sharpshooters after you. Women, sharpshooters, and my God, they will interpret that as they please, or you can interpret that as you please. But I think it's very important to give us some semblance of a higher level, and we need a women's international court. Now, I think on that court right away, we could have women like Sandra Day O'Connor, women who thought they were finished, but we need their expertise. Women like Elizabeth Edwards, who really has made an astonishing comeback. And that's what we need. And we also need, whenever there's a runoff between two women and one woman wins, let the second woman be a winner. Let her go to the court. All these women that run and come in second, and what do we do with them?
I hear what you're saying. I thank you so much for your point. I think what she's also saying is that when women are in positions of power to create justice or opportunity, then there is more of an opportunity for things to change, and we thank you so much for that. I think that maybe what we ought to do, because I know time is running short, and we have had one woman over there who's been waiting very patiently. We'd like to hear your question, ma'am, and that you'll be the final one. I'm so sorry for everyone else. Yes, go ahead.
Cadet Margaret Fountain from West Point. My question kind of deals again with the societal gender inequalities in developing nations. Those gender inequalities, as we've seen from the progression of gender equality in our own country, take a long time to overcome because they're often very deep-seated. What kind of practical measures can we take today to start affecting gender inequality issues that seem to be the basis of many of these health inequality issues in these developing countries?
Does anyone have an answer for that? You're asking, what can we do about these gender inequality issues that are creating these health inequality issues?
It seems, ma'am, at least to me from listening to the panel, that the access issues are based in gender inequality.
Right. I think that she's making a very good point, which is the reason why there's health inequality is because there is one of the major reasons is because there's health inequality, or because there's gender inequality, and I think that's kind of brings me back to sort of the original thing. You know, we have in this country gone through a sexual liberation or a women's liberation movement, which is, some say it's undone, some say it's unfair, but whatever you argue about it, it has unleashed women in the workforce in a way that had never happened in the history of this country. And I think that those of us who've benefited from that and understand what could have not happened, perhaps it's time for us to speak for women elsewhere. Yes.
Can I say that, using me as an example, I'm the first ever woman to be elected to anything.
In Nigeria?
In my zone, from where I come from.
Wow.
I'm the first. And when I was a baby, I'm sure my father would say it's crazy for anybody to say she's going to be a member of the House of Representatives. It's crazy. Because when I was born, women don't elect. Then they don't elect, they don't get elected. So, but then my father stood firm and put me in school. I lost my father at the age of 10 years, and my uncle continued that I must go to school. So that education made me who I am today. Because through school, you can be able to say yes, to say no, to understand those cultures that are discriminatory to women. See, education is one tool that can make a lot of change.
But she's asking about your being elected. Has that helped then resolve the problem of gender inequality?
Because what I'm doing now, I'm bringing those issues to my community, which was not earlier discussed before. I can talk about HIV/AIDS, which was a taboo. I can talk about early marriage. I can talk about family planning, which ordinarily people say, oh, she can't talk about it, she's a woman. It's the jurisdiction of men to decide how many children I can have. But with me going to school, I can say, no, I don't want to have this number of children. I want this number of children. So really, a lot of things is happening through us that went to school. Now we are going back to empower our community. And then more women, more people, more communities are saying, a community being served by a woman legislator is more developed by a community being served by another male legislator. So we have more men, more women. There are many men, gender-sensitive men. Many, including our speaker who could not come here. There are many men that are supporting women because they saw the value of women being educated in Nigeria. So with education, a lot of things can happen.
So this revolution has already started. Yes. Our time, however, has ended. I'm happy that we have been interesting enough to be pushing the clock. And I just would like to really thank everyone here on this panel who makes us know that I think we all know now that the future is coming, the future we want.
Right. Thank you. I'm Tamara Cranen. I'm with the United Nations Foundation, the Executive Director of Women and Population. And I'd like to just take a minute to sum up where I think we are and invite everybody next door for a reception to continue this conversation informally and perhaps to practice talking about these issues over cocktails. I think I'm struck more than anything that this conversation is really about political will. I think we have the political will to go to war. We have the political will to pay for war. And yet somehow we lack that will for our women and girls. I think we should broadly share a few critical numbers. 200 million women want voluntary family planning and don't have access to it. 536,000 women die every year in childbirth. 22% of those deaths could be prevented through family planning and reproductive health services. Those few numbers, or whichever numbers you choose, coupled with a few stories, I'd like you to hold with me in your mind's eye that baby that Anne talked to us about, that baby turning blue, and that woman trying to pump by hand her back to life, or him back to life. And share those stories broadly and help us create political will. We in the United States are looking for some small dollars for our women. A little over $1 billion for reproductive health and family planning, a little over $1 billion for maternal health and child health. And yet we're fighting an uphill battle. We want to share that battle with our elected officials and get them on board with us. I'd like to suggest that all of you help us wish for girls and women globally what we wish for our daughters, our granddaughters, and our nieces, and that we fight fiercely on their behalf. I'd like to thank our panel, both esteemed, inspiring, and humorous, and I would like to thank our partners in sponsoring this motivating and inspiring panel. Please join me next door for a glass of wine.
Let's go have a glass of wine.